Basics of Radiology in Veterinary Medicine. X-ray discovery. X-ray were discovered by accident. In November, a German sixth known as Wilhelm Conrad Röntgen discovered X-rays while experimenting with an evacuated glass tube containing two electrodes through which an electric current can pass. He named the new type of radiologist X-rays because it was unknown to the scientific world and because like it considered to travel in rays. Radiation kisk produces cellular damage that is respirable when radiation comes into contact with the live cells. 4 and 5 can pass through cells with two effects: produce cells damage that is respirable, produces irreparable cells damage, and mate the cells of the body. How can wear mini cell exposure? Well, their ways are typical used to minimize radiation exposure. 1. Use leal protectors. 2. Increase distance. For 3. Reduce exposure time 5 minutes. Technique. A technical table is a valuable resource for X-ray technical personnel, as each machine must have its own technical types, as all machine models are different. A technique that works for one machine might not be the best technique for another machine, even when the environment and the radiographic anatomical are the same. Once the graph is developed, the correct technical setting is chosen for each individual patient according to the thickness of the tissue and the anatomic area of interest. Positioning and interpretation. Proper patient positioning is important because X-ray of incorrectly positioned patients may be misinterpreted. In a two-letter abbreviation, the first letter designates where the ray enters and the second letter indicates where the rays exit. Radiography readings is based on the reconstruction and analysis of structures with different relative radiographic operatives, which describe the ability of X-ray to penetrate tissue and the other substances. Because the gas is very radiotransparent, it provides a good contrast for visualizing more radiopaque structures or organs with the body. Wither and muscles appear as shades of gray on X-ray. White, clear bones generally mean the organs are as differentiated as possible. And metal can be seen on X-ray in the animals as swallowed a metal object or as surfeit a butter wood and is retained. Metallic objects show the relatively easy to identify on X-ray because they will be the most radiopaque because X-ray are two-dimensional. At last, two diagnostic X-ray should be taken at right angles to each other. The use of different angles will help the veterinary interpreting the structures in the dimensions. Types of X-ray. There are different X-rays, which are chest, lungs, heart, abdomen, liver, gallbladder, spleen, pancreas, stomach, small intestine, large intestine, kidneys, and urinary bladder.